Welcome back, everyone. We are officially on part 14 of our 100-part CPC exam series. Today, we're doing a high-yield, systematic breakdown of what is literally a microscopic battlefield. We're talking about the hematologic, lymphatic, and immune systems. So grab your notes because we are packing a ton of absolutely critical coding information right into this explainer.
But hey, before we secure this knowledge, make sure to like, share, and subscribe to Decode Healthcare with Harshal. Seriously, it helps us keep this massive exam series going and ensures you never miss a single update. All right, here's a quick look at the syllabus for today's 8-minute explainer. We got a lot to cover, from the hematologic system and high-yield WBC types, right into lymphatic anatomy and immune system defense. Then we'll tackle autoimmune versus immunodeficiency, and finally wrap it all up with a cheat sheet and a sneak peek at part 15.
Okay, let's dive into this. Section 1, our hematologic system breakdown. This is where we look at the raw materials.
Now, as a coder, you've really got to remember that this system is super documentation-based, relying almost entirely on lab findings. So, first things first, you have to know your raw materials. The bloodstream is essentially made up of 4 major components, and for the CPC exam, you must know their formal medical terms. We've got plasma, erythrocytes, which are your red blood cells, leukocytes, your white blood cells, and thrombocytes, which you probably know better as platelets. And when you're tested on systemic disease descriptions, there are 4 common blood disorders that pop up all the time. We're looking at anemia, leukemia, hemophilia, and sickle cell disease. Being able to spot these instantly, that's going to save you some precious time on test day for sure. Moving right along to Section 2, high-yield WBC types, basically our cellular roster. Guys, this cellular roster is a massive high-yield focus for the exam. You'll notice how neutrophils act as your first-line responders for bacterial patterns. Then, lymphocytes handle your adaptive immunity using T and B cells. Monocytes, they step in for phagocytosis and cleanup. Eosinophils are totally linked to allergies and parasites, and basophils act as your inflammatory mediators. Pinning down this roster helps you decode those complex lab reports in a flash.
All right, on to Section 3, Lymphatic System Anatomy. Let's explore the terrain.
Think of it this way. If the blood is your transport network, the lymphatic system is the actual physical terrain where all the defense routing and filtering happens. You need to instantly recognize these key structures and operative nodes: the lymph vessels, the lymph nodes, the spleen, and the thymus. And right alongside them, you're going to frequently code diagnostic and procedural terms like a CBC, bone marrow biopsies, and splenectomies.
Now, when things go wrong in that terrain, we see some very specific common lymphatic pathologies, like lymphadenopathy, lymphoma, and lymphedema. Remember, as a coder, lymphatic anatomy is frequently localized by very specific node regions and organ involvement, so you always want to look for that location specificity in the patient's chart. Now, what's really interesting about this next part, Section 4, the immune system defense. We are entering active combat. You can really think of your immune system as having 2 primary lines of defense. Innate immunity is basically your non-specific castle wall. It relies on physical barriers and phagocytes that respond immediately. We're talking 0 to 12 hours. Then you have your adaptive immunity. These are your special forces. It's a delayed response, maybe 1 to 7 days, but it is highly targeted. Let's drill down a bit more into those special forces. Adaptive immunity relies on memory-based B cells, and these produce specific antibodies, like IgG, IgA, IgM, IgE, and IgD. They work right alongside your killer and helper T cells. Understanding this delayed, specific response is incredibly vital for grasping the concept of chronicity when you're actually coding infectious diseases. Which brings us to Section 5, autoimmune versus immunodeficiency. Let's look at the pathology contrast.
So what exactly happens when this complex defense system breaks down? Well, this carries some heavy implications for medical necessity. It basically breaks down in 2 primary ways. On one side, we have autoimmune disorders. This is a hyperactive response where the body actually attacks itself, like what we see in SLE, rheumatoid arthritis, or Hashimoto's. On the other side is immunodeficiency, where the body's defenses are literally destroyed. A prime example is HIV/AIDS, which specifically destroys T helper cells and massively increases the risk for opportunistic infections. Okay, wrapping things up with Section 6, our visual cheat sheet and a little teaser for Part 15.
We have covered a tremendous amount of ground today, so go ahead and get your screenshot fingers ready.
This one-page visual cheat sheet beautifully summarizes all the key elements and common pathologies across the hematologic, lymphatic, and immune systems. Seriously, keep this handy as you take your practice exams. It connects the raw anatomy directly to the clinical conditions you're required to code. It's pretty amazing, right? This whole breakdown brilliantly illustrates just how foundational anatomy is to our profession. But now, I really have to ask you, are you ready to take these anatomical concepts and apply them to laterality, topography specificity, and those tricky look-alike anatomical terms? Because that practical coding relevance is exactly what we are tackling next in Part 15. I can't wait, and I'll see you there.